Hello, my name is Madison Spell-Flores, and I'm going to be doing a presentation on the disability category of deafness. I'm going to be voicing over my PowerPoint. I hope you learn a lot, and I hope you enjoy. Hello, my name's Alexandria Spell-Flores. My category is deafness, and this is for Special Education Disabilities course at Lipscomb University with Professor Andrea Pewitt. So deafness is a hearing impairment that is so severe that the child is impaired in processing linguistic information through hearing with or without amplification that adversely affects a child's educational performance. So in layman's terms, this means a hearing impairment that is on either the severe or profound scale, and that child is having trouble processing language through hearing, whether they have hearing aids or not, or amplification or not. And even with help, it's either not helping to the point where it is affecting the child's educational performance. So there are different characteristics of deafness. There's different ways to scale how profound or mild a child's deafness is. And if we look at these 4 different degrees of hearing loss, the first 2 are not considered deaf. They are only considered hearing impaired. The last 2 are considered deaf. So if we start at mild hearing loss, this person could hear some speech sounds, but soft sounds are hard to hear. So they can hear mostly everything, but when they have help, or even without help, if it's amplified, they can hear it. Next, we have moderate hearing loss, which they may hear no speech at all if the person's speaking normal, but if they speak louder, they'll be able to hear it. They'll also be able to hear louder sounds. And then the next 2, which are considered deaf, are severe and profound. So severe hearing loss means they can't hear any speech at a normal level, maybe some loud sounds, but they're definitely going to need hearing aids or amplification to help them hear anything. And then profound hearing loss typically means they can't hear anything at all. And if they have hearing aids or amplification, they'll be able to hear very low sounds or very high sounds, but it will not be the normal way that we hear. So there are 12 different ways to identify the type of deafness a person is, and this is normally done by a medical professional. And all of them say or because it really is either or. So we have unilateral and bilateral, and that is they're deaf in either one ear or both. Prelingual or postlingual, and this is really important for a teacher to know and the IEP team. So either they lost their hearing before they learned to talk or after. And this is important because if they never heard anybody communicate their language, then it'll be much harder for them to learn how to read and write than if they were to already be able to speak and hear and then lost their ability to hear. So that really affects their educational performance. We have symmetrical or asymmetrical, so they hear exactly the same in both, or one ear is different. And this can affect where they should sit in the room, what side you should talk to them on. So the teacher also needs to know that. There is progressive or sudden, which means it worsens over time or it happens quickly. We have fluctuating or stable, so it gets worse or better over time or it stays the same. And then lastly, we have congenital or acquired delayed onset. So either their deafness was present when they were born or it was acquired later in life. And that could be caused by a disease or some sort of birth defect that caused them to have it later in life. So this video is a little long, so I won't play it, but it basically talks about the difference between deafness and hearing impaired, which is important because they are both separate categories under IDEA. Mild or moderate, it's a hearing impairment. If it is severe or profound, it is considered deafness. So even though a student is deaf, has a diagnosed medical disability of deafness, it does not mean they automatically qualify for special education services. They need to still be evaluated. So the evaluation process is very similar to any other student with a disability. The only thing that is really added is the audiological evaluation. And this is a test to determine the type and severity of the hearing loss. So those 12 identifications we talked about earlier, the doctor will evaluate those to see which one the student falls under, and then also if it is actually deafness or just a hearing impairment. they're still going to be evaluated by speech and language, normally by an SLP or a speech language pathologist. They're going to look at their school history, their educational performance, and that all has to do with data. So make sure you are keeping your data for everything. It is very, very important. And then there's going to be observations of classroom performance, and then also interviews done by or for the parents and the classroom teacher to see if there's anything that they were missing from the observation. So this evaluation is going to tell us how the student's educational performance is affected. And so that really helps guide the IEP team when writing services. People involved are the parents or the legal guardians, the gen ed teacher, the special ed teacher, the medical provider to diagnose the deafness, a speech language pathologist, and then depending on what the child is struggling with, any other professional personnel as needed. So students obviously are going to have academic struggles, but the most important struggles that teachers and parents need to focus on are their social emotional struggles. So right at the bottom there was a study done between deaf students ages 11 through 17 and found that 41% of those students had emotional and behavioral problems. That is a huge percentage, and it is probably even more than 41% because of students who don't report their mental health. So this is a huge problem that needs to be addressed because mental health is so important for students to be able to learn appropriately. They have a higher risk if they're deaf of the social phobia, anxiety, and emotional problems compared to their hearing peers. And then they also will have difficulties in social and emotional development because they're going to struggle with expressing that emotion. So teachers and parents need to be very aware of that. Parents and teachers will begin to see academic loss in kindergarten or first grade, some, but the most significant will be in third grade. So I was actually able to teach third grade for 2 years, and I can tell you that that jump from second grade to third grade is huge. And if those deficits are not met and properly taken care of or helped in those lower grades, once they jump to third grade, it's going to be very, very difficult for them. So that also needs to be addressed. If the deafness came early on, they need to address it early on. So parents and teachers can both help their students in a lot of ways. Parents mostly are encouraged to find peer support of other parents who have deaf children to help them. They also need to be super informed of all of the ways that they can help their child. And there's a ton of resources for that. Parents also need to be aware of where their child is mentally to help their mental health. And one way they can do that is, and to make sure that it's stable, is just to make sure that they are in some activities that they love. Teachers can help in a lot of ways just by the way that they lay out their classroom, by the way that they treat their students, by the way that they include the deaf students with the hearing students, making sure that they feel loved and taken care of. Also, teachers need to stay up with the most beneficial strategies and resources for their deaf students. And sometimes, if a school is not properly prepared, it falls on that teacher to make sure that they have everything that they need. It's not always fair or correct, but that always is a possibility that the teacher needs to be the one to advocate for that student. There are a ton of resources for parents online. The community is super huge and supportive, and so if parents need something, they can definitely find it online. There are a lot of intervention strategies such as closed captioning, a sign language interpreter, lots of visual aids, visual instructions, visual schedule, hands-on learning and real-life examples, and then always how teachers teach. They can be super animated, making sure the deaf student is following along, and then repeating materials repeatedly because they might not get it the first time. And that is the category of deafness. If you have any questions, you can email me and I will do the best I can to either research or give you the answer from the research that I already did. I hope you guys enjoyed and I can't wait to see your presentations.